All right. Welcome, everybody, to the first event in our lineup for SNHU Internship Awareness Month 2025 virtual sessions. My name is Corey White. I am a employer relations partner here with Southern New Hampshire University Career Services. We are so grateful that you've taken the time to join us today for the Healthcare Internships presentation and employer panel. Please keep in mind the session is being recorded, and we have also turned off mics and cameras if you would like to. That way you can stay focused on the presenters and the panelists. But please feel free to locate the chat at the top of the banner here and submit your questions. We'll be collecting those throughout the session, and we'll get to hopefully as many as possible during the Q&A portion later on. But also feel free in the chat also to introduce yourselves, tell us what major you're in here, and where you're calling in from. And other than that, we have an excellent panel lineup for you today of guests, as well as a couple of my colleagues from the internship team here to present. So with that, let's get into it. And also, if you're experiencing any technical issues or need support during the session, you can reach out to our IT service desk. And I believe my colleague will put that information into the chat. So welcome. To make this as an engaging, session as possible, definitely you want to get accustomed to Microsoft Teams and the capabilities here. So you want to familiarize yourself with some of the features. We have live captioning options, as well as various written language options, as you can see on the screen, and the ability to move through slides at your own pace if you wish to do so. And the chat box, like I had mentioned earlier, you can find up at the top. We've included some of the instructions for using Teams into the chat as well, and with those features mentioned. And with that, we will move right along. Again, we have a deep commitment to inclusion and accessibility. And your experience here at Southern New Hampshire University is very important to us. It's our policy and practice to create an inclusive and accessible learning environment for you. If there are aspects of this event that present barriers to accessibility, please definitely take a look at some of the accommodations that we have available to you, located on the screen there. But if you're an online student, you can reach out to OAC at snhu.edu or by phone at 866 305-9430. If you're a campus student, you can reach out to CAC at snhu.edu or by phone 603-644-3118. And if you are, of course, SNHU staff or faculty, you can reach out to our HR department at hr@snu.edu. With that, we've covered some of the housekeeping items that are essential for a smooth and engaging session. And also, as you can see at the very top, there's a react button. At any point, if you really like what someone said, give a thumbs up or another type of emoticon to let them know that you're engaged. And with that, we will get started on introducing some of our presenters today. So join me in welcoming some of our key presenters and my colleagues and moderators for the session that are internship administrators here within SNHU Career Services. We have Hannah Royce, Jennifer Freand, and Beth Waugh. Hannah, you can take it away.
Thanks so much, Corey. So I am Hannah Royce. For my visual description, I am a white female with brown hair wearing a black shirt today. My pronouns are she, her, hers. I am an internship administrator, and I specifically support our Master of Public Health program at Southern New Hampshire University, and I will turn it over to Jen.
Hi, everyone. Thank you so much for joining us today. My name is Jennifer Freund, and I'm also an internship administrator. I also support students in the Master of Public Health program. So I will pass it over to Beth.
Hi, everybody. Thank you for being here. My name is Beth Wall. I also am an internship administrator, and I work with various healthcare majors, HIM, healthcare administration, public health undergrad, community health. So I work with all of our healthcare vertical students. And with that, I kind of want to introduce you to the agenda that we're going to cover for today. So first of all, we're just going to take just a couple of minutes to talk about SNHU's career internship services and the benefits of having an internship in your career path. We're going to meet our panelists who we're so lucky to have with us here today. We're going to learn from them, and they will share their insights on internships and how valuable they are to you and your career goals. And then at the very end, we will have a Q&A with our panelists. So if you would like to put any question in the chat, Jen will be moderating that. We can ask at the end. And also at the end, you're free to come off mute and ask questions if you prefer to do it that way. So whichever way you prefer, we'll try to make sure all of your questions get answered today. And if you're not familiar with the SNHU career team, I just want to cover just a little bit about what our services offer to you as a student. So, really, anything that involves your career path, whether it's trying to define what career path you really want to go to in your major. Internships are so valuable to learn that as well. And we can help you with any of your professional documentation, resumes, cover letters, personal statements if you're trying to get into grad school. We can help you with Handshake if you're starting to look for that job. So once you have an interview, we can help you with, interview mock prep. So we can do anything that we can help you along that career path. And then I just real quickly want to cover benefits of internships. And I know that our panel is going to really, really delve into this a little bit more. But it's really important because internships can obviously help you network with people in your field, get to know how they got there, what they like most about their job, what they like the least about their job. It can also help you decide, well, this is something I really want to do, or this is something I really don't want to do. So internships are really valuable that way. They're also really valuable in getting that in-field experience on your resume or your portfolio and really decide what your passions are. So with that, I'm going to turn it over to my colleague Hannah, and she's going to introduce our panelists to us today. Thanks, Hannah.
Thank you so much, Beth. So first, I want to welcome Molly Sagara, the HIMSS Associate Director of Banner Health. We have Molly's background information on the slide for you to review. And Molly, would you be able to briefly introduce yourself?
Yes, good morning, everyone. My name is Molly Segura. Let's see, I got my first start in healthcare back in 2012, just working front desk at an ophthalmology clinic. From there, I was a certified ophthalmic technician, helping in minor procedures and exams and things like that, progressed into clinical management. I quickly realized I kind of needed a degree and a formal education to open doors for me and get that salary that we all want. So I jumped into the health information management system undergrad at SNHU. Completed that, been working in HIMSS leadership the past 7 years. Currently working for Banner Health, as you saw. And then I returned to school for my master's in healthcare administration.
Thank you so much, Molly. As you noted, you completed your health information management degree. You did that here at SNHU. And we also understand that you completed an internship. So how did completing an internship guide your career?
Yeah, so I was really happy that it was a requirement for our degree program. For me personally, I completed my internship at a smaller ambulatory clinic, whereas now I work in a centralized department that mainly focuses on acute care. So my internship, because it was with a smaller clinic, it really allowed me to mold my experience to how I wanted it to be. I got to work really closely with physicians and back of the house staff that kind of focused on rev cycle, and I could get out of it what I wanted to, rather than jumping into an acute care, say hospital system and working in a HIMSS department there. Um, and then I was able to better understand what I do and do not want in a career. So for example, I realized I don't want to work in ambulatory care. I don't want to work in a small clinic. I want to work in a larger health system, probably in operations. I was privy to a lot of the challenges that we see in clinical care, like siloed access to information, technology resource restrictions, a lack of patient-centric mindset, especially in rev cycle functions. However, that's not strictly in ambulatory care. I think that's throughout our health system. But I was able to see where my interests were and where they were not. And it guided me to kind of the operations path that I am on now.
Wonderful. Thank you so much, Molly. So now I'm going to introduce our next panelist, Kendall Vaughn from the New Hampshire Department of Health and Human Services. We have Kendall's background information on the slide. She is also a Southern New Hampshire University alumni who completed her master's degree in public health here. Kendall, would you mind briefly introducing yourself?
Yes. Hi, thank you for having me. I'm coming to you live from my home office, so thank you for joining me in my home. So yes, I completed my degree in public health at SNU during the golden time of public health, March 2021, which if you look at COVID, for a lot of people, it's a positive and a negative. For me, it was positive because there were so many jobs, so many jobs. Public health is exploding with jobs. So I was able to get my foot in the door at the COVID response in New Hampshire. And using that leverage, I was able to get hired on full time as the HIV epidemiologist. So I'm very thankful and grateful to be able to serve everyone living with HIV in New Hampshire. But also working for DHHS, we're very small, so I'm able to hop in on other conditions as well. I've helped out with TB investigations, hepatitis C, STIs, all manner of things. So I'm very lucky to be able to have all that experience. But that is not what got me into public health in the first place. What got me into public health was my previous career as an exercise physiologist at a children's hospital in Virginia. I wore many hats there, but one of them was working with a pediatric weight management program. And my medical director, who is still a mentor to me today, was slowly pushing me towards looking at the healthcare system from a population perspective, looking at healthcare from the structures and institutions that we have in place that influence the social determinants of health. And from that, I just got hooked, and I started my master's in MPH, and COVID happened, and then here I am.
Thank you so much for sharing, Kendall. I do have another question for you. How do you think completing a public health internship could benefit students?
No way it can't benefit students. I've had a couple SNU interns with me in the past. I have one currently. And my goal with all of my interns is to give them an experience. Lucky for my intern currently, she's getting the full government experience with all the changes that we are experiencing right now. The landscape is shifting, so that experience of being able to navigate all those changes as they're coming in real time is invaluable. Not just for an internship or employment opportunity in the future, but for life, being able to adapt on the fly as we are right now. And the skills, for all my interns, my goal is to teach them skills so that they can put those skills on their resume to make them more marketable for employment opportunities. Like, for instance, right now, my intern is she's learned how to make a website, she's learned to make a flyer, she's learned how to design a survey, and we're going to be analyzing the results of that survey next week. So she's going to learn how to do a qualitative analysis, which is something that a lot of students aren't taught to do. We're taught to do quantitative, but qualitative is something that I think is very important to teach. She's learning, she's learning R programming. She's learning how to code so she can and analyze data in repeatable ways. She's learning Excel tips and tricks, learn how to make pivot tables, so that any job she jumps into, she can quickly adapt to the tools that she has available to her through her employer. And then lastly, the networking. Networking is huge. Networking is how I got my job. Networking is how I got my internship when I was completing my master's. Especially in this day and age, especially if you're trying to get into any kind of government sector, networking is crucial to be able to know, we call it a warm handshake. If you know somebody within an organization that can vouch for you, that speaks volumes. And if they can't help, then perhaps they know someone as well. So just shaking your network tree. And then networking also makes references readily available. Like my preceptor for my internship, she's my reference for everything. And I've been a reference for all of my students as well. So yes, tons of ways of benefits, and I really can't see why anything that would deter someone from an internship.
Thank you so much, Kendall. Huge benefits and great advice on networking as well. So now I'm going to introduce our next panelist, Wilson Pace from the Dartnet Institute. Wilson, can you briefly introduce yourself, please?
Sure, thanks. I'm Wilson Pace, family physician by training. I was a faculty member at the University of Colorado School of Medicine for 37 years. Also was the director of the AFP's National Research Network for 11 years. 14 years ago, helped found the Dartnet Institute as a private not-for-profit research institute. We could talk more about in the past. As a company, about 25% of our staff have terminal degrees, and about another 55% or more have masters. So we're a very high-end workforce. All of our terminal degree people all come from academia. So we're also very focused and work closely with educational groups around the country. And so our team have mentored many PhD students, master's students, taught more in the graduate level with medical students and MPH students. And Colorado, of course, has a school of public health as well as the medical school and the nursing school. So we're very comfortable with all those kind of activities. We'll get into that, but we have supported a lot of capstone programs. We've done a few PhD programs. We have massive availability of data and health services research opportunities and every type of analytical construct. I agree with the last talk with mixed methods and qualitative approaches are just as important as quantitative, and we do all of that within our organization. I'll stop there.
Thank you so much, Wilson. Another question for you. What skills or qualifications are most in demand in the healthcare field right now?
Well, there's a few different ones. If you're in the clinical side, and I'd be interested in hearing the Molly's side from the Banner Health side, but I would think really primary care clinicians are really hard to find right now. So from the clinical side, there's a lot of different specialists, but primary care is just almost impossible to find. From the non-clinical side, the health information technology activity, and Dartnet's heavily involved in that, continues to outpace the number of people that go in. Both, I mean, finding CMIOs, finding the high-level people is particularly difficult. But I think that Cerner and epic analysts, you always are running out of them. Partly because we seem to do everything over again. By each major healthcare organization wants to do it themselves, and we don't share as many resources as possible. And then, of course, on the last side of it, not so relevant to this, but nurses particularly are shortage everywhere. So there's lots of different shortages. You wouldn't think so, given how much we spend on healthcare in this country. And you don't need we could talk about the problems with that as well. But there's a number of areas for people to think through. And they're not all clinical. You don't have to have a clinical background to be in healthcare by any means.
Thank you so much. Yeah, definitely sounds like there's certainly lots of needs in healthcare. So now I'm going to ask a few more questions to the panelists. So we'll start with Kendall, and then I'll also ask Molly and Wilson the same question. But Kendall, what internships does your organization offer, and how do students find these types of opportunities?
This is such a great question. I feel like typically students look for internships online for things that are posted within whatever organization they're looking at. Within DHHS, we have very few of those. Off the top of my head, we only have 2 internships that we post for the public to apply to. So internships here, you have to get a little creative. So I always say, and no matter what field you're going into, is find your passion. You were talking about that earlier. Find your passion. Because if you know what field you want to go into, if you know a specific condition you want to work with, if you want to be environmental health, if you want to be in infectious disease and a specific infectious disease, reach out to that person who's in that role and kind of describe yourself and tell them what you're looking for. I'll say in government right now, you have to know what you want and kind of market yourself to say this is all the skills I come with, and I would love to learn what you do and help out in any way I can. And always mention public service, that we're here to serve the public in government. So reach out to people and kind of be persistent if you're not hearing anything back. And then I guess be prepared for rejection. If you're reaching out and cold calling essentially for internships. But yeah, always reach out, email, call, be persistent, know what you want, and market yourself well in an email or a call.
Thank you so much, Kendall. Those are great tips. I agree. I think direct outreach is really important, and that follow-up piece as well. So now let's turn it over to Molly with the same question. What internships does your organization offer, and how do students find these types of opportunities?
Yeah, so I can speak specifically about the HIMSS internships because that's what I personally help coordinate for Banner. So I'm sure that we have other ones. However, I'm not privy to that information. And the good thing about HIMSS is it's kind of a niche specialized field. So once you know one person, you almost feel like you know a lot more people from other organizations, even across the country. You do a lot of work with vendors and stuff. So that can work in your benefit if you network. Like Kendall was saying, that's such an important piece of obtaining a practicum. I have a lot of students who join professional networking boards. On Facebook, for example, there's an AHIMA networking group. I have found a couple students just that way. I was perusing one day, and someone would make a post saying, hey, I'm a student at SNHU. A couple of them were from SNHU. I am trying to locate an internship opportunity. Does anyone have advice? And I was really easily able to reach out, say, hey, message me. I'll get you set up. We'll find a host for you and get the ball rolling. And it worked really smooth. And those students never would have known had they not put themselves out there, tried to network, taken a chance, learn from others in the field. So all of those things are really beneficial. The worst case, you'll not get a response back, or maybe someone will say, I don't have the ability to take on this extra responsibility right now. But I have found that more often than not, people want to help you. And if if you reached out to someone within Banner, within the HIMSS department and said, hey, I am interested in doing an internship in your department, though that team member may not specifically, know how to go about it, they could get in contact with their leader who would say, hey, I want to get you in touch with Molly. And then I could, reach out to you and again, get the ball rolling that way. So a lot of network, a lot of just reaching out. If you want to do your internship with a local hospital, then call around to your local hospital. Show up in person. Most facilities, again, him specific, they have a facility team member. If they're not centralized, you could just show up in person to the hospital and say, hey, I want to do an internship here. How would I go about that? Who can you connect me with that can give me more information? And so, yeah, that would be my suggestion to all of you. And then keep your mind open. As I explained earlier, I did my internship at a smaller clinic, so it wasn't part of this large health system that is ever popular now. And it was great for me, and it really again guided my career to where I am now. So keep an open mind with what an internship can mean to you. Know what you want to get out of it. If you have a specific area of interest, go into your internships and be upfront when you're speaking with someone saying, I'm getting into health information management. It's a pretty broad field. This is my area of interest. And they can better help find a position for you within that organization. And really, it comes down to creating your own opportunities. No one's going to seek you out and say, "Hey, I have this golden opportunity for you. Come hang out with us at Banner." But if you make the effort, if you put yourself out there, we are so happy to help. We really want to set students up for success and get excitement about our field. It might not seem exciting, but I swear it really is. Um, and then please use your internship coordinators. I am not sure if that was an option back when I was enrolled at SNHU, but it's such a luxury. So again, use those connections. We have contracts with a couple different universities, and it's a resource that I don't think enough people utilize. So yeah.
Great advice. Completely agree with you with that networking, direct outreach, trying to reach out, use those connections that you have, and connecting with your internship administrator as well. So thank you so much there, Molly. And now I'm going to turn it over to Wilson for the same question here. What internships does your organization offer, and how do students find out about these types of opportunities?
So we don't have any actual formal internships right now, though we are listed on the SNOOS website as an organization that we're more than willing to mentor students with their capstones or what other activities they have. That said, we have currently, I think we have 42 different research projects ongoing, and then a number of commercial type projects as well. And those projects are constantly looking for support and help and interactions. And once again, 100% of our terminal degree people have all said they're willing to mentor folks into all kinds of areas. Just to give you, those include physicians, qualitative researchers, quantitative researchers, PhD psychologist, PhD. Actually, one is a microbiologist, but she works more in the health services research area. And then we have a lot of senior master's level people with both masters in public health, masters in statistics, masters in health administration, and they're all willing to help and support people as well. So we are heavily into health services research and clinical research and health information technology. To give you an idea, we currently have electronic health record data where we cut back, but at the end of 2021, we were receiving electronic health record data on 44 million Americans. Now we've cut it back to about 20. So if you have things that need data, access to practices, interactions around anything from social determinants of health to functional assessment to EHR kind of activities, and you think that's an area of interest, contact us. We are on your website. we're always looking for the next person to interact with or the next person we can mentor. We do have a formal activity going on to try to establish internships with various institutions. I can tell you right now that probably the more common first internships we'll establish will be more like in the postdoc region. We work with 60 different academic medical centers around the country. And so we probably would start there, but we'd be willing to work with, we just hired an undergraduate to work on one of our projects for 6 months. She learned a whole lot and had a great time and then went off to her graduate degree. So contact us about what your areas of interest, and we're pretty broad again. Do have administrative activities, health services, research activities, clinical activities from blood transfusion to mental health to primary care within diabetes, respiratory, 42 projects. So it's a lot of different activities.
Thank you so much, Wilson, and so exciting to be involved in so many different projects there. So for my next question, I am going to start with you, Wilson. What advice do you have for students searching for a healthcare internship?
Well, I think like Molly and Kendall said, reach out. You can look online and try to see what formal activities there are. And then expect that most of them will have lots of people applying. And so, you'll have that kind of activity, but you'd be surprised how many of us, I think Kendall indicated that works like that when somebody comes and says, gosh, here's an area I'm interested in, and it seems like it overlaps with what you're doing, that people will work hard to figure out ways to include people. I guess the other question is, there's a difference around who has longer term paid internships, and those of course are a huge advantage and one people would like. Or if you don't have that much time and you're more interested in trying to fill in some activities within a semester or something, or maybe even do something that you could actually work into a credit like activity that may not be paid, but we may be able to have lots of different kind of individuals to support that kind of activity. So just always reach out. It doesn't, our HR person is always taking different people's interests and trying to match them up with what we have available. We work a lot with the School of Public Health, University of Colorado, because that's where I came from. But we also have been taking students from SNU as well.
Wonderful. Thank you so much, Wilson. I'm going to pass it back to Molly. So do you have any other advice, Molly, for students searching for a healthcare internship?
Yeah. Well, Wilson, I think I want to go work with you, hang out with you a little bit. That sounds really great. Really echoing what Wilson and Kendall have said, get out of your comfort zone. Don't be afraid to reach out to people. I think that when I first got in the field, I was a little bit intimidated. You're working with a lot of executive levels or providers, doctors, NDs, and it can be intimidating. But at the end of the day, I would say we're all people. We all want to help each other because we all want to strengthen the field. We want to strengthen healthcare and patient care and just grow as an entity. So I would kind of have that in the back of your head when you are reaching out to people, that just assume that everyone has good intent and does want to support you. And again, not everyone might be able to help you, but perhaps they can guide you to someone that can. I would start searching early if you know that you have to complete one to finish out your degree program. Really start that networking process early on for our HIMSS internships. The clearance process alone takes 30 days. And then sometimes it takes me a little bit to find a host that's willing to, take on new students just because we are all busy. So we do want to help, but sometimes that process itself can take a little bit. So as soon as you know that that's going to be a requirement for you, reach out. And I don't think it's ever too early, even if you have to do one next year or next semester or whatever. Just reach out, let us know, and really make sure that your spot is secure. And then, like I said before, utilize your internship coordinators and any resources that SNHU has. It makes a huge difference. Makes life easier on you, really.
That's great advice, Molly. Yes, we are here to help at SNHU and completely agree. Trying to plan in advance is also a great strategy there as well. So, Kendall, any other advice you want to share for students searching for a healthcare internship?
I will say, personally, I will mentor anyone who wants to learn. If you're reaching out to me directly and I can hear that you want to learn and that you're internally motivated to do a great job, um, and I will, and many of my colleagues, we will bend over backwards to find something for you. Um, as I said earlier, we don't have many internships. I think I two off the top of my head that we have externally posted. So any internship or intern we took, we would have to find a project for you. But again, if you want to learn, we want to teach. That just has to be clearly expressed.
Can I have one last piece that I
Of
forgot about?
course.
Sure. I also want to just indicate that we actually have boots on the ground research going on in Kenya, where we're working on improving cervical cancer follow-up. We have clinical research trials that are spread between the United States, the UK, and a team in Singapore. And we have data work going on in 16 different countries around the world. So if you have an international bet within the healthcare area, we also probably can find some things to interact with as well.
Wow, that's really exciting. So, well, the final question that I have is what tips do you have for students to be successful once they secure a healthcare internship? And if we can start with Molly on that one.
Yeah. So once your internship is secured, I would just be really invested and show interest, ask questions, make connections. We have quite a few students that partake in our internships. And so I think it's important to try to differentiate yourself some way, not necessarily to every person that you come across. Um, but I would, ask those questions. If you see a team member that you align with particularly or an area of interest that you think, hey, this is something I could see myself doing, reach out and say, hey, can I get a one-on-one with you? Can we set up 30 minutes just to chat? It doesn't necessarily have to be the most formal of meetings. It doesn't have to be something that you really thought of all your interview questions that you want. It can just be a laid back conversation. I want to learn more about what you do. I'm interested in this area. And kind of be, squeaky wheel kind of has a negative connotation, but be that squeaky wheel and find your opportunity and be in it for more than just college credit. Be in it to advance your career and to kind of get where you want to go. I would be really strategic with how you spend your time. And then, yeah, just network and always be willing to get out of your comfort zone. I think that's something that I cannot stress enough.
Thank you so much, Molly. Great advice there. And Kendall, do you have any tips for students to be successful once they secure a healthcare internship?
First, I echo everything Molly just said, like everything she just said. Yes. As I work in government, and the national landscape is changing within government, especially in public health, I would say be prepared to adapt, be prepared to a change, be prepared to get creative, as some funding streams might just disappear overnight, as we've seen. But that work still needs to happen. It still needs to get done. So we need innovative thinkers and we need people to draw on their previous experiences to say, this is how I've done it before. And it's never, I don't know, like it might not have been done in a government setting, but how about we talk about it? And always, always, always be willing to learn, get thrown into something that you've never done and see that as a positive and see that as an opportunity for you to gain a new skill, you to gain a new bullet point on your resume. And for you to really get out of your comfort zone, as Molly said, and welcome new changes and welcome opportunities.
Great advice. Thank you so much, Kendall. And then Wilson, do you have any tips for students to be successful once they secure a healthcare internship?
So I agree with you. I agree with Molly and Kendall about all the things they said. I think in our kind of a organization, and I suspect when I hear from Kendall and Molly that if you get an internship and or working with us, you're going to be working with a team of some kind, not the entire institution, not the entire group. And we are a virtual company, so it doesn't matter where you live. Everybody in our company works pretty much from home, so that will feel you'll be fit in. But not only ask questions, as everybody said, that's important, but be willing to pick up some things. Oh, I can look into that for you. Or if there's something comes up, we need to understand more about X, Y, Z. Say, well, let me try to find that out. You're not being graded. It's initiative. It's trying to fit in. It's trying to see how you can actually advance a teamwork's activity that will stand out. And so be willing to put your hand up and say, I can try to help in that area. Because from our perspective in much of the academic world, internships and postdocs and groups like that, they're expected to add value. They're not there just to learn, but to actually add value to the team they're a part of. And so see if you can add a little value along the way, and that will stand out.
Great advice there in terms of adding value. Thank you all so much. So we're down to about 4 minutes here. I'm going to now turn it over to Jen to share if we have a few questions that may have come through the chat or if folks want to raise their hand and ask any questions.
Great. Thank you so much. Thank you for all of your insights so far, panelists. We really appreciate it. We don't have a lot of time for questions, but we're going to take some time now to address some of the ones that came through, and we'll try to follow up on any of the questions that we maybe didn't get to that you've answered. So we had some questions related to furthering a higher ed degree. So one of the questions from the students was, when did you know or realize you wanted or needed a master's degree? So I don't know if any of the panelists had any insights or ideas about that question. Feel free to just jump in if you want to add.
For a lot of the jobs in my bureau and the Bureau of Infectious Disease Control, a master's is required. I think it's bogus. We've incorporated recently, our HR has incorporated a caveat where you can replace a master's degree with X numbers of years of experience, and I am all for that. There's so much to be said for experience over academia. But I realized I wanted to get a master's because I loved learning. And I missed learning. I missed learning in a classroom environment. So that combined with knowing I needed a master's to get the job I wanted because it was a requirement led me to get a master's.
Excellent. Thank you so much, Kendall. Another student was asking, what are some questions I can expect from an employer when I go looking for an internship? Some of the types of interview questions, perhaps, that you may all ask when you're speaking with them. Anyone want to jump in?
From our perspective, we're interested in people that want to learn more about the things that we do. It could be in the IT side, the data security side, the research, health services research side, the clinical side. But it should at least have some idea that this is something I'm exploring, and it's not just to check a box. And then, of course, the other part that we always try to ask about is, in various ways, kind of prior experience of being part of teams. I can't emphasize enough that from the research world, research is a team sport, and if you can't play well with teams, then you're not going to play well in our environment. So those would be the two key things that we would try to focus on.
Excellent. Anybody else want to jump in, or otherwise, we're down to our last minute, so we will follow up with all of your questions that we didn't quite get to today. But someone asked an interesting question, looking for anything inclusive for a healthcare internship as a person with a disability. Are there any advice or places maybe to start? I'm not sure if any of your organizations, if you have any insights on accommodations or that. Yeah, if anyone wants to jump in. Looks like a couple. Yeah.
I'll just quickly, from our perspective, once again, we're a virtual company. Everybody pretty much works from home. We are not a direct provider of healthcare. So if that's what you want to do, then that's not what, I mean, I was for years, but that's not what our company does. But if you're interested in the side of healthcare that has to do with services, research, or delivery or quality improvement, I don't think disabilities have any concern. We have people that have all kinds of different needs. And as long as you can function in your environment, you can function in our environment.
Excellent. All right, well, we are at time. So thank you so much to our presenters. We appreciate all of your amazing insights this session. So like I mentioned, if you've asked a question today that we weren't able to respond to you, if you have additional questions in the future, please reach out to SNHU Career Services. And lastly, please check out our resources like Career 360 and Handshake to find more SNHU career events in the future. Hannah's going to go ahead and post some links in the chat as well as our contact information so you know how to get a hold of us. So I'm going to go ahead and pass it back to Corey for him to help close out the session today.
All right, thanks, Jennifer. Again, I want to thank our audience. You were so engaging. I saw the chat lighting up with tons of good questions. We'll definitely do our best to get to everything that we couldn't get to in the session today. As always, these things go by super fast. We could probably be here all day kind of sharing insights and things, but I wanted to thank our panelists today, Wilson, Molly, and Kendall, for being here, sharing your advice with students, insights, and all of your backgrounds. I certainly learned a lot. I hope you all did as well. And I also want to thank my colleagues from the internship team, Jennifer, Beth, and Hannah, for being here and being rock stars doing this session with me. So again, just want to leave you with a couple of things. I know there's a tons of resources being shared in the chat, but also this was just part one of our Internship Awareness Month sessions. So we do have another event coming up next week on Wednesday, the 16th of April, at the same time, 12 p.m. noon Eastern time. I'm going to put that information in the chat, and it'll also have the registration link in case you would like to be in that session. We're going to have another panel of employers for that one, including DirecTV, an organization, an accounting organization called Eide Bailey. We're going to have DirecTV, FEMA, and the American Heart Association. So you definitely don't want to miss that one. That session is going to be all about why experience matters. So if you enjoyed this session, you're not definitely going to want to come to that session as well. But other than that, you've been a tremendous audience. Again, thanks for joining us today, and we will see you on the next one. Bye-bye, bye-bye.